The May 2020 Able Foundation report helped us to see our beloved city with new eyes. In the early days of the information superhighway, tech pundits assured us that the net would level the playing field and be a virtual panacea of opportunity for all. There's a similar situation in Scripture, a place known as Lodabar, whose inhabitants are cut off from the rest of civilization, living in crippling conditions, disconnected, and in need of every imaginable resource. The story of Lodabar was penned circa 630 to 540 BC, that we can reference it for meaning and guidance in 2020 is a scary commentary on where we find ourselves on today's communication and connectivity landscape. And that's where DIPS technology comes in. As far back as 2013, we've been working with Baltimore's faith-based community to bridge the digital divide primarily on the matter of healthcare. Fast forward to now, and the pandemic has exposed a litany of additional issues and challenges stemming from a lack of connectivity. Using small cell technology, we can remove the barriers to learning, healthcare, and city services, bringing Baltimore into a new possibility for living. The absence of a secure and consistent Wi-Fi connection widens the education gap for school children, creates unnecessary health risks for seniors, and presents a considerable impediment to accessing city services for all. The urgent need for our solution is clear. The question is how quickly our project will be funded. We are a virtual team, a CEO with deep roots in the faith-based and community organizer space, a CTO with decades of experience in network development and administration, and our COO, a career publisher, is masterful at delivering news and information across a variety of platforms to audiences of color. Together, we make an explosive team. Kareem, tell us how you're going to build our VPN.
It starts with the first bridge. Installing a T2 line, a leased data communication line, capable of transmitting 6.3 megabytes per second. It is a dedicated unshared connection through the local telecom provider. Because it is a dedicated line, it is a much more secure connection. The next section of the bridge is establishing a virtual private network, or VPN for short, designed with a robust infrastructure capable of supporting multiple nodes to stream internet services throughout selected Baltimore communities. The VPN network will enable residents to connect to the internet free of charge with filtering capabilities to ensure surfing the web is a good experience. Our filtering algorithms will filter out explicit material, creating a worry-free environment for parents. Residents will have the ability to connect to the internet with any Wi-Fi enabled device, such as a cell phone, laptop, or tablet. Our network backbone will be established in local religious centers. Each center will serve as a hub for their community. The final phase of the bridge is closing the gap and having information readily available to the community.
We generate revenue by creating pools of seniors accessing telehealth services over our VPN. A pool is 200 seniors with Medicare regularly using telehealth service. The value proposition of each pool, $1.5 million in revenue annually. Our first priority is to get our target communities connected. We'll hit several milestones during the 13 weeks, but the VPN is the most important. The city can help us succeed in a number of ways. Some are granting us the right-of-way permits for our small cell antennas, allowing us a seat at the table of real solutions, and securing funding to expand our solutions citywide. The Able Foundation identified a serious problem, one that the COVID-19 pandemic exposed with a great sense of urgency. The Sankofa Community Network is ready to partner with the city in implementing solutions with immediate deployment. The social impact of our project is clear. Our profit model unmatched. The question is simply how fast Accelerate Baltimore can write the check.